Sorry about this. All right, I believe we are now live. My name is Taylor Slocum, so we just had a really great conversation with a nurse practitioner with Chelsea Francis, one of our career counselors doing the interview, and now we're shifting on over to talk with Christina Marr, who is a respiratory therapist, to learn a little bit more about that career path. So first off, thank you so much for coming and participating and offering your insights today. We're so grateful to have you. And yeah, we can go ahead and dive on in and just give you an opportunity to introduce yourself and what you do.
Well, my name is Christina Marr. Thank you guys for having me today. I've been here at OhioHealth for about 14 years now. I graduated from Lancaster High School and went to OSU. I have my bachelor's in respiratory therapy, and I started working here at Grant as a student therapist. I was here at Grant for about 6 years, and then I kind of moved into a supervisor role. So that's kind of where I'm at now. I currently manage the day shift here at Grant, and then previous to that, I help manage the freestanding EDs and open those at Westerville and Pickerington. So I've had some experience here at Grant and some smaller sites too as a therapist.
Oh, wow, amazing. And what first initially got you interested in field?
We're freezing a little bit. But what got me interested in respiratory was that the question?
Yes, sorry about that.
So I started out kind of, like a lost high schooler wanting to go pre-med. I realized I didn't want to be in school forever. I got interested in medicine. My sister had childhood brain cancer, so growing up, I kind of saw her go to the hospital, a lot at Nationwide Children's, and just kind of it intrigued me, I guess, to be in the healthcare field. So about halfway through college, I switched majors to respiratory therapy. I didn't really want to do nursing. I didn't want to go to school forever. So I saw respiratory therapy, and I'm like, what's that? And so I went and talked to Herb, who was the director of the program, found out some more about it. We had the commonality. He was going to go to dental school, and he was like, that didn't work out for me. And so that kind of led my path to respiratory. I think it's not a very well-known career. And so, a lot of people don't know it even exists. But that's kind of how I found it, by switching majors, and it was a good fit for me because I still get to use a science and math background, and of course be in medicine without having to go to school for 12 years. So.
Absolutely. And I think respiratory therapy is often it's like a little known secret. I think a lot of people it's such an amazing career path, but students sometimes just get set on, nursing or something like that and don't realize some of the other amazing career paths that are out there. Would you mind kind of talking through what what are the job duties of a respiratory therapist? What makes it unique to something, like nursing or something like that?
Yeah, so respiratory therapy is kind of on the same level as a nurse. It's kind of, pay and kind of your role in the hospital. But we're more specialized. So we're more specialized in cardiopulmonary patients. So patients with heart problems, with lung problems are our main focus. So we get to focus more on helping the patient breathe, essentially, whether that be helping put them on a ventilator, helping them with breathing treatments, in an outpatient setting, helping them do diagnostic PFT studies. So it's more of a focus on the lungs and the heart and the function of those things.
Absolutely. And what would be a daily life of a respiratory therapist? What could a student expect in this role as far as like what would their day look like?
If you're working in a hospital, which is probably where most of the therapists work, it it could vary a little bit. Here at Grant, we're more of a trauma center, so we deal with a lot of emergencies. So it could be a patient coming into the ER that can't breathe that you help put on BiPAP or help intubate. It could be a patient from a car accident that can't breathe or is unresponsive. We help put them on the vent. So it's very fast paced. We respond to any code, any emergency in the hospital. So it's a very kind of action day. You kind of go from one critical incident to the next, which I'm an adrenaline junkie, so I'm fine with that. But we usually stay pretty busy. With nursing, you're kind of more with the same couple patients all day. We're kind of all throughout the hospital, just responding wherever we're needed. We do have patients that we take care of and give routine treatments, but we're kind of out and about a little bit more.
Right. So it sounds like it's not like a typical day, like you come in and expect to work with a certain amount of patients. It's like different cases each day, a lot of traumas. Like you said, probably being kind of an adrenaline junkie or somebody that's very flexible and adaptable would be really good skills to have in this field. So that's really awesome and really interesting as well. So it sounds like there's a lot of varying to the day as well. So that if do you have any advice for like what kinds of tips or advice do you have for someone just starting out to be marketable when they go to graduate into this field and look for jobs in respiratory therapy?
Well, there is a shortage, so there's probably a good chance that you're going to get a job because we really need a lot more people. But just having good customer service skills. If you have some healthcare background, that's great as well. But a lot of what we do is relating to patients and helping to take care of them. So if you can relate to people that maybe you don't have all the respiratory skills yet, but you have that personality that you want to help people and you can relate to people, I think that's probably the most important thing.
Definitely. So definitely gaining patient care experience can be helpful along the line prior to clinicals too. So that's definitely very helpful advice, for sure. And it's funny that you say there's a shortage. I think Columbus State's program, like it's an amazing program. I want to say, and Chelsea Francis is on the chat at the moment, but I want to say it's something like 98% placement rate. So Chelsea, correct me if I'm wrong, but it's something like you said, like Christina said, you definitely the likelihood of getting a position, there's a huge need, so it's a really good career path to go into if you're really interested in medicine. So that's so good to hear. And then one question too that had come through previously with signups was how has COVID impacted your job?
Extremely. So being a respiratory therapist, we are at the forefront of dealing with respiratory diseases. So we've had to change a lot of protocols. When there are many days we're pretty much in PPE for 12 hours, the entire shift. We've also done some innovative things. We've taken like the ventilator screens and put them like outside of the room. So there's been a lot of innovation, a lot of kind of workaround. It kind of took how we functioned in the past, and we had to change a lot of things because you kind of have to assume every patient coming in here might have COVID. So how can we keep everybody safe in the hospital as far as the staff and the patients or anyone walking down the hallway to help control the spread? So it's definitely rocked our world, to say the least. But, we've had plenty of PPE, no issues there. It's just, making sure we're not sending out aerosols or anything with the things that we do.
So it's definitely, it sounds like there's definitely a need for your role with kind of with everything that's going on with COVID, and for protocols and designing protocols and helping to stop the spread as well. So it sounds like you're right at the forefront with everything, um,
Yeah.
which is crazy. Um, and, you know, so one thing that we want to offer students is, or one question that we have is, what's your favorite part of the job, and what's your typically your least favorite part of the job?
My favorite part is just like helping people breathe better. Like it's very rewarding when somebody comes into the ER and maybe they can't breathe because they're asthma or something, and being able to help them, whether it's giving them treatments or putting on BiPAP. It's really rewarding to be able to help. You know, not every job lets you do that or impact someone in that way. So that would be my favorite part, just knowing that, hey, I helped somebody today. Least favorite, we do deal with a lot of trachs, being respiratory therapists, so that's like a surgical airway. Sometimes people get a lot of secretions and they can cough and kind of launch those up that trach, so that's probably the grossest part. Uh, so that's probably my least favorite, but it comes with the job, and you get used to it, so no big deal.
So it kind of balances out having that patient care satisfaction versus some of the nitty gritty kind
The,
of gross
the
procedural
kind
stuff.
of gross, the gross things that come with it sometimes.
Oh, that's perfect. I feel like sometimes with healthcare, it's like a guarantee there will be crazy, crazy stories, kind of like the gross side of things too. Um, and then another question too is, you know, what's the best piece of career advice that you have received that you might want to relay on to any of the students today?
I would just say, you know, if you have an opportunity and if you go into respiratory and are doing clinicals, like don't be afraid to jump in and to try something and to learn. So always be proactive and, you know, be ready to jump in there, because you want to learn everything you can, because you're going to need that to take care of people later on. So just always make sure you can really, you know, give it a try. Don't be afraid to try.
Absolutely. I think that's helpful advice. I think that's been the theme of the week, has been like taking a leadership role and be taking initiative with everything as well. So I think that just kind of echoes with everything. Like, and I think it comes with the healthcare profession too, to be curious, to put yourself out there, and to definitely try and learn as much as you can. So I think that's super helpful advice. What was your education like your educational path, since you mentioned clinicals, and then also what's the typical education level that you hire at OhioHealth in respiratory therapy?
Yeah, so I would say I have my bachelor's, but probably the majority of our staff has their associates. Um, and I think, you know, that's a good career path as well. A bachelor's a little bit more helpful if you want to advance, but just to, you know, get in the door, an associate's degree is perfectly fine and teaches you all the same things. So, and I know right now Ohio Health does have a scholars program. So if you are employed at Ohio Health, you can attend Columbus State's program for free, if you get accepted into that program, because respiratory therapy has been recently added to the scholar program, because we have such a critical need. So that's an option too for maybe, you know, people working full time that, um, you know, are looking to venture into something else. I started, you know, kind of from high school going into this, but we have a lot of people that come here as a second career too. So an associate's degree will, you know, be great. So we'd love to have you.
Excellent. Yeah, everybody out there, definitely, definitely. Ohio Health wants you. They want to hire you. And that was one question that come in from a student, is just does Ohio Health work with Columbus State students? Do they do their clinicals through Ohio Health? Which sounds like Definitely. They definitely
Yeah.
do.
Yeah, and we have quite a few respiratory students that come through our department here at Grant, being a level one trauma center that kind of excites a lot of people. And then a few of our staff members here at Grant are like clinical instructors for Columbus State. So we have a good working relationship with them and definitely a strong connection to the school. So.
Absolutely. And do you have any, from your perspective as kind of working with our students and things like that, do you have any, like, is there something that any students do that helps them stand out from maybe some of their classmates? Anything that you notice or tips that you might have for students to be able to stand out? And I know you mentioned kind of like taking initiative, asking questions, being willing to learn. Is there anything else you'd want to add to that list too, to help them stand out?
Yeah, I mean, just doing a good job in clinicals. We kind of look at that honestly as like an interview. I mean, we have a lot of students coming through here, so um, when you're at our hospital, we're watching. We don't expect students, of course, to know everything, but are they professional? Are they taking initiative? Um, how do they treat the patients? Are they kind and respectful to people? So just, I mean, those sort of things. You know, you're a student here, so you're representing us. So we're gonna, kind of see how what your demeanor is, and if you'd be a good fit for us here.
Absolutely. I like that you said it's kind of clinicals are basically like a 1 to 2 year long interview. In career services, we're always telling students that too, where it's like it's basically like when they come in for interview prep, it's like you have unknowingly been interviewing for this
That's
entire
right.
time. So it's like that we're always like, definitely think about your connections and finding, thinking of who could be a reference for you, who you stand out with, who you connect with, thinking of it in terms of that. But I love that you touched on that too. It's definitely, I think clinicals are a great opportunity to learn the field. And then also, it's always good to be on your best behavior and professional and show up on time, take initiative, all those types of things. Because it's one of the longest interviews that
Yeah,
you can have.
for sure.
And what was kind of your experience as a student? Like, what was your first day of clinicals like?
My first day of clinicals, well, I always feel like I've had a black cloud because my first day of clinicals, we were like out on the floor doing like breathing treatments, which should be pretty basic, pretty easy breathing. And the room I walked into, the guy had throat cancer and his throat began to close, and so he became critical. My preceptor was like, "Can you help me?" So he ended up going to like surgery. So I think I've naturally had a black cloud where things are like crazy no matter where I go. But clinicals are usually pretty smooth and not like that. But I think most everyone has had good clinical preceptors that make sure, even if things get crazy, they're going to take care of you and they're going to teach you, and you're not going to be like thrown into anything you're uncomfortable with. Um, but you never know what's going to happen. So
So definitely be prepared for anything. It sounds like typically it goes pretty smoothly, but it sounds like in your first day it was a little bit more challenging and not what you
yeah.
necessarily expect. You were like, I'm doing breathing treatments, I'm ready to go. And then it turned into, oh gosh, like full on
So
trauma.
you never know, but be prepared for anything, I guess.
Yeah. And do you have any advice with being in this role and kind of always, a large part of the job is doing traumas and working with, people that are going through like maybe being in a lot of pain or things like that. Do you have any self-care tips or tips for managing stress or anything for students?
Yeah, I mean, it can definitely be stressful. We never know what's going to come in here, and sometimes, you might see something really sad, or it might be very stressful. So, kind of our theme here is that Ohio Health is you can't take care of anyone else if you don't take care of yourself. So, um, you have to take care of yourself first before you can take care of others. So we just kind of encourage everyone to like remember that. So if you need a minute to to step away from a situation, or, you know, if something's going on, we try to support each other and work as like a family, you know, and you got to take care of yourself first. So I don't know if I have any like extreme tips, but just whatever you need to take care of yourself is what you need to do.
Absolutely.
Whether it's to talk it out, or you need a day off work, or whatever it be. So you can't let everything overwhelm you.
Excellent. So it sounds like kind of coming into it, knowing, being self-aware and knowing what works best for you with managing your stress is helpful, and just being aware that there are stressful pieces to this, you know, this position and this role, I think is really helpful. Um, and we did have a question come in from Facebook. A student is wondering, you know, what are the hours like for respiratory therapy? Like, are there different shifts? What would a schedule kind of look like, or what are the options out there?
Yeah, typically at our care site we have night shift and day shift. So we do 3 12s a week, so either 7A to 7P or 7P to 7A. So you'll see that at a lot of hospitals. Some places do 8-hour shifts or something, but most hospitals do 12. But you only work 3 days a week, so that's kind of nice. If you're in like home care or like a PFT lab, a lot of times they work like 40 hours a week, like 8-hour shifts. So there is some variability depending on what kind of route you take to become a respiratory therapist.
So it sounds like there's definitely some flexibility. There's different pieces that you can get into. It's not like you know, I think one of the questions that a student had sent in is it similar to like nursing hours or something like that? And it sounds like it definitely is. It's healthcare, so it sounds like your group typically works 3 12s, you know, which is helpful to know. So it is flexible. And then another question came in from Facebook. What are the top skills needed to be a respiratory therapist?
Just, I guess, being able to remain calm, because you're going to be running into a lot of emergency situations. Um, you know, you're in respiratory school, they're going to teach you a lot about ventilation and kind of the science with that, as far as like flows and volumes. Um, you know, so a little bit of math and science when it comes to that. Um, we draw blood, we transfuse blood, we do medication delivery. So there's quite a few different things we do, but it's just a good science and math background, and then, you know, good relationships with people. Everything else you can really learn in school.
Absolutely. So it sounds like, yeah, some of it comes naturally, some of it you're going to gain through your clinicals and education. And I think just kind of reiterates it's good to get in the healthcare background early, start in that field so you can get your feet wet, even if it's volunteering or something like that, just to get exposed to different codes and things like that. Another great question that came in is what are the opportunities for advancement within this field, and how do you get there?
That's a good question. So some places have like a clinical ladder, and also like different areas to work. We have, you can work in kind of any area here at Grant, so there's an opportunity. We usually have like a charge therapist every shift, so there's opportunity there to like promote even within the department. And then a lot of people use respiratory therapy to advance into other careers too. We've had some go back to school for MPs, PAs, and then, you know, we've had a few people go to med school or get their bachelor's in like healthcare management and do like kind of more non-clinical sides as well, like quality, or like supply. So it can definitely use it as a bridge to do something else too, if you want to get out from being in the bedside later on.
Sounds like there's lots of room to grow, and you know, definitely can still continue to build your education. Are there other like because I know with like nursing and things like that, there's certain specialties and different certifications in that arena. Or is it similar to respiratory care? Are there like certifications you can get or things like specialty areas, or is it kind of all across the board usually with it's like different. You kind of have to be skilled in everything.
Yeah, there are specialties you can get into. There is like a neonatal exam, so if people want to specialize in neonatal care, that's an opportunity. There's also PFTs, there's special certification for that, so the pulmonary function testing. So for pulmonary labs, like the diagnostics, measuring lung volumes and stuff. And a lot of that happens kind of at like a physician practice kind of situation. And then there's also adult critical care specialty licensing you can get to more for critical care. So there are some exams and some advancement opportunities within the hospital too for those sort of things.
Very cool. So it sounds like you can get those specialties through like the hospital can help get you the training and all those different types like hours and things like that.
Yeah, a lot of those tests too are through the NBRC, so the National Board for Respiratory Care. So you can become like board certified in those specialties as well.
Excellent. And then with that board, is that something that students can join now? Is there other student accounts and things like that? Kind of with
For the national board, I don't know if they have too many student things, but the NBRC controls all of the licensing for respiratory therapy. So once you are a student, when you go to take your national boards, those are going to be through the NBRC. So you would naturally kind of start taking those tests while you're still in schooling. So I think they do have maybe some student opportunities. On, I'd have to check their website, but they're based out of like Kansas, I believe. So
So it sounds like you naturally start to get involved with that as you're a student
yeah,
throughout, just because you have to be a part of it in order to get your license and certification.
you have to pay them to take your boards, so that makes you a member.
Gotcha. Perfect. And then another really good question came in too. It just says, do you have any advice for students who want to learn more about being a respiratory therapist and maybe just aren't sure, like they know they want to go into healthcare, but they're just unsure what route to take?
Yeah, I think a good opportunity is shadowing, even. And we've let some people shadow here at Grant before. With COVID, that's a little bit challenging right now. But if anyone's not sure, I would say, maybe try to shadow someone, or they could definitely reach out to us here at Grant and we could provide them with some more information.
Is there like a good way to reach out? Should they just like call a main number, or is there an email that they can touch base with or look for on the website?
Yeah, I mean, they could even email me, Christina.mar@ohiohealth.com.
Perfect. Great, that's awesome. So it sounds like definitely shadowing is a big thing, talking to people in the field, and just seeing how that can be figured out. Because I think that's a big tip for students too. Because I think, we always talk about sometimes we have the nursing student who will come in, has done all the classes, and then realizes in their first day of clinicals that they faint at the sight of blood kind of thing. um, so definitely, like, I think shadowing is a big thing. Volunteering, getting your foot in the door is so incredibly helpful. Just so you can see, like you mentioned, like you're an adrenaline kind of junkie. So this is a really great role for you where it's like you're up and moving, running around, dealing with different traumas, different things, have good problem solving in stressful situations. So I think it's good to, yeah, like observe it and see where you fall, because I know me personally, I'm the most frazzled person ever. I would be the worst respiratory therapist. I would be panicking all the time. But yeah, I think it's just like such an amazing role. Is there any like final advice or anything that you might have for students interested in this career path that you would like to leave with them today?
Oh, I guess if anyone has any questions, feel free to reach out. I think I've really enjoyed it personally, being in this career. It's kind of action packed and keeps you busy and learns a lot. And I think a career in healthcare is very rewarding, getting to help people. So um, come join us.
You heard it here first. Ohio Health wants respiratory therapists, wants healthcare workers. So
So
everybody watching today is an excellent candidate for sure. Well, wonderful. And I just want to open up if there's any remaining questions or anything to anybody on Facebook, feel free to submit those. But this has been a really helpful conversation today. And I think, again, I think respiratory therapy and respiratory care is a hidden gem within healthcare. Like you mentioned, the job place or the needs for the job for job placement are huge. It's a really great career path. It has a lot of similarities to different healthcare fields as far as like hours and things like that. So I think this is an amazing career path, and I hope I learned a lot today, and I hope other people learned a lot too, and hopefully you get more respiratory therapy students coming your way here here soon. But thank you so much for your time today and for all your insights and everything. We're very appreciative of that.
thank you so much.
Thanks. So we're going to sign off now from the live stream. Tomorrow we have a physical therapist at noon from 12 to 12:45, and then we're meeting with medical simulationists and learning about the field of medical simulation, which is another area that a lot of people don't know about. So we will be tuning back in here on Facebook tomorrow and wrapping up an amazing healthcare week. So we're going to let everybody enjoy the rest of their day. We're going to sign off here, but thank you so much.